Are there nutritional supplements you can take to reduce plaque formation in arteries? I'm Dr. Eric Westman, and welcome back to my channel where I review and debunk nutritional misinformation online. In this video, we're going to look at nutritional supplements recommended by Dr. Eric Berg and many other people, and take a critical look as to whether these really are helpful. Be sure to listen to the end where I'll give my final thoughts. I'm hosting a free diabetes lab workshop on April 29. If you have prediabetes or type 2 diabetes, this lab workshop will show you the key lab tests to assess your metabolic health. What you need to look at besides fasting glucose and hemoglobin A1C. What triglycerides are and why they're essential to measure. How a low-carb diet can help to reverse type 2 diabetes. Register now to make sure you don't miss it. I've added the link in the description, or you can go to our website at adaptyourlifeacademy.com.
Let's talk about the best nutrients to remove plaque from your arteries. When I talk about plaque, I'm talking about three things: the combination of cholesterol, a certain type of protein that creates the fibrosis, and we're talking about calcium. These are the three ingredients to form a Band-Aid when you have inflammation or some type of problem in the inside of your artery. The first thing to know is there's two types of plaque. There's soft plaque, and then there's hard plaque or calcified plaque. They're both very, very different. The soft plaque is very unstable. It's more dangerous. The hard plaque, the more dense plaque, the more stable, the less dangerous. The soft plaque is 4 times as common as the calcified plaque. When you get a CAC test, they give you a score, and this score really represents how much plaque you have in your arteries, mainly the calcified plaque, because a lot of the soft plaque is involved in the turning into calcified plaque. That does not show up on a CAC score. Now, there's something called a CAC paradox, in which you might find that your CAC score goes up after changing your diet, cleaning up the bad stuff, and starting to get healthy. The score might go up. Well, what's happening, it's not getting worse. You're just converting more of that soft plaque to hard plaque, where it becomes more stable. And there's some other tests that you can do, which I'm going to explain at the end.
Well, hold on right there. If you haven't learned about coronary artery calcium scores yet, it is a non-invasive way to look to see if you have calcium in the arteries of the heart. And calcium is a reflection of healing of a inflammatory lesion, we call them lesion, or an area affected on the artery. You can think of it as a sunburn. You have an area that's burnt, and then the calcium and other protein and cholesterol comes in to help heal that. As you see in the classic Dr. Berg great video, is that the Band-Aid comes in to heal where the inflammation is. You can think of that inflammation as the root cause. If you're changing your diet, you're changing your inflammation, so you're actually taking a change in a therapy not by nutritional supplements, but by changing the diet that you're consuming. And many people have come to me worried about their blood cholesterol levels, and I'm changing to more of the importance of these anatomic or arterial measurements rather than just blood cholesterol scores, because the blood cholesterol is not a disease. The disease we're trying to prevent is atherosclerosis, or the blockage, the narrowing, this calcification on the arteries themselves. And I know the traditional medical focus has been to focus on cholesterol, but it's not really good enough. You want to get some measurement of your arteries, like that calcium score. So if your calcium score is 0, there's a large set of information that says your risk of a heart attack over the next 10 years is very low if you consume an American diet, because that's the conditions under which these studies have been done. So some people want to get a calcium score, others don't. Some cardiologists are not aware of it or don't know to order it or don't know how to evaluate them. But it's a popularization of getting more information about your own body. Often you have to pay for it out of pocket. And you might recommend that or say to your doctor, hey, I'll pay for it, because they might not order it because they're concerned you may have to pay out of pocket. And there's nothing like an angry patient who thought insurance would pay for it and insurance didn't, and they come back to the doctor blaming the doctor. So anyway, take away that concern by saying you'll pay for it if it's something you can afford. So that's the idea of the calcium score. The calcified plaque is the healed plaque, the non-calcified plaque that it will not be picked up on a calcium score. It's just one of the limitations of that calcium score. It's interesting in this video and in kind of in the current anti-plaque formation and language, there's very little, if any, talk about aspirin or reducing the clot that might form on top of a plaque. And there's a lot of data, large randomized trials about aspirin use over the last decades. And so if you're a carb eater, you burn what you eat. So if you're a carb eater, you're a carb burner. And there are large studies and several major organizations nationally that recommend taking a baby aspirin if you've had some sort of heart problem or a stroke. And then major guidelines do not recommend a baby aspirin if you have not had a heart attack or stroke for primary prevention. So it's kind of similar to the statin use in my mind. If you don't have the disease yet and you don't have evidence of the disease, don't take a medicine that's going to prevent a disease that you probably don't have. You want evidence of that disease before you're taking either a baby aspirin or a statin. But they're not going to talk about that in this video. So let's continue on other supplements that you might be able to take for reducing plaque.
That will help you identify more of the soft plaque, because that CAC test really is not the best test to pick up this soft, dangerous, unstable plaque. But I will talk about what tests you should do about this to assess this problem in a moment. You usually have something called glycation connected to it. What is glycation? It's where you have a sugar and a protein that gets stuck together. And so that's involved in a certain protein that kind of locks up and creates problems and inflammation in your body. This soft plaque is usually involved with more oxidation, okay, especially of the LDL. And I'm not talking about LDL in general. I'm talking about the one that's more pathogenic. There's two types of LDL. There's the LDL that's much smaller. It's called the small dense LDL. Okay, that's the more dangerous type, the more pathogenic type, versus the other LDL, which is very different. It's the large buoyant type, and it's not the pathogenic type. You just have to realize there's two types. I'm going to show you a very simple way to use what they give you on your blood test to determine.
So this is another explanation of the difference between insulin resistance, which gives you the small LDLs, and the non-insulin resistance that gives you the large buoyant LDLs. And a low-carb diet changes the quality of these LDLs. And so when you get an LDL test from your doctor, if it says LDL calculated, it doesn't tell you what type of LDL it is. There are more advanced lipid tests that you can take. But again, I've gone beyond just looking at this. You have to look at the blood. You have to look at the arteries themselves to know if you have, or if you're if you've already developed or you're at risk for progression of atherosclerosis. That's what we're really trying to prevent.
What type of LDL you have. The first one, it's a long name, myeloperoxidase. The next one is LP-PLA2. So those are the two biomarkers that help pick up if you have this soft plaque. Now, another test that probably would be even better if you can do this, and it's a relatively inexpensive, quick, non-invasive test. It's an ultrasound of your carotids, and that gives like a 98.6% prediction of having the problem.
So I prefer going to the arterial determination, that test. You can look at the arteries of the neck. Of course, that doesn't give you a view of the arteries of the heart, which is what that calcium score test is. Both are ways to see if you have the disease that measuring and treating cholesterol is trying to prevent. And I don't use myeloperoxidase or the other measurement. They're not really specific enough. And again, they don't tell you whether you have the arterial disease or the extent of arterial disease that you might have.
There's some other really important values to look at too, is your HDL. Okay, you want that to go up. HDL tends to clean up that pathogenic bad LDL. The next thing you want to see on the low side is triglycerides, because if the triglycerides are high, then you can pretty much know the person's consuming too many carbs.
And that goes along with what's called the metabolic syndrome. In the blood, you don't look at the total in LDL for the metabolic syndrome. You look at the HDL and the triglyceride. And the triglyceride to HDL ratio can tell you whether you have insulin resistance or not. So we look at the blood in a different way when we're looking for metabolic syndrome. You want the triglycerides to be low. And yes, they're generally a reflection of eating sugars and starches, the carbohydrates in the diet. The triglycerides, so the fat in the blood comes from the carbs in the food. I know that a lot of doctors get tripped up on that even. And then you want that HDL, known as the good cholesterol, to be as high as possible. I just saw someone recently in the clinic whose HDL was 120. It went from 80 to 120 after a few years on a low-carb diet. So the way to raise an HDL is not to exercise more. That gives you it may give you 10% elevation, but this was a doubling or 200% increase if you go from 80 or 60 to 120, for example. That's a 200% increase in your HDL.
Now, there's another test that if you can get this, it's a really good way of assessing what's really going on with these lipids, okay? And it's called lipoprotein insulin resistance. If you happen to get a blood test and you can request this, it'd be very, very important to know where your number is at, because out of all of the factors, that's the one that's the most associated with cardiovascular atherosclerosis.
Yeah, so that's the LPIR, lipoprotein insulin resistance. It's on the NMR lipoprofile blood test that you can take at really any doctor's office now, or at places where you don't even need a doctor in many areas to get these blood levels. That's the NMR lipoprofile. Remember, the typical LDL calculated that you get from your doctor is not going to tell you what type of LDL you have. And I would argue that you really don't want to look at the LDL so much. You want to look at the triglyceride and HDL just because they're more powerful in terms of metabolic syndrome.
All right, so now let's discuss how one can figure out if they have the small dense particles for the LDL versus the large buoyant, okay, without even doing that test. What you do is you divide the LDL by something else called ApoB. It's part of the lipoprotein that indicates the number of particles. Ideally, we want it to be greater than 1.2, which will indicate large buoyant LDL, which is the non-pathogenic version.
Well, I'm learning that there are many different ways to measure these things, and it depends where you live. Even in the U.S., medicine is practiced differently, and let alone worldwide. So I never measure that ApoB in my area, but there are parts of the country where they do. I think many of these are like just different ways to measure the same thing. The LPIR being fine, the triglyceride HDL ratio being fine, the LDL ApoB ratio fine. These are just getting at the same blood predictor. Again, they don't tell you whether you have the arterial disease at all.
Now, all of that is very interesting and a bit complex. So I want to jump into what nutrients can help remove this plaque, okay? Well, the first two nutrients are...
So if you've had the CT angiogram or the coronary artery calcium score or the ultrasound of the neck carotid artery or the aorta, the abdominal artery and you have no disease, this really doesn't apply. So if you have a calcium score of 0, don't worry about these supplements here. You really don't need them because you don't have the disease. Now, let's say the coronary calcium score is not 0 and the ultrasound of the neck shows some disease, or the aorta, or you've had a stroke, or you've had a heart attack, then these nutrients may be something you want to listen to. Let's see what evidence there is.
Pycnogenol, that's pine bark. You'd want to take 150 milligrams. Pycnogenol helps convert the soft plaque to the calcified plaque where it becomes more stable, and also it prevents the formation of plaque. And the next one is called Gotu-Kola. You'd want to take 450 milligrams of Gotu-Kola. Gotu-Kola helps enhance the function of pycnogenol. So it's going to help this conversion to more stable plaque. It will also prevent the formation of plaque.
Well, so I'm going to be a little bit of a devil's advocate here, and I just have to understand my position. I want to recommend things that have high level of evidence. In fact, the low-carb diet now has been studied for over 2 decades. There's a textbook out called Ketogenic, The Science Behind Therapeutic Carbohydrate Reduction and Restriction. These things that we're looking, I looked to her pycnogenol and Gotu-Kola. These are not by any means studied to the level of a prescription drug. And the reason that's important is that not only can you get benefits from these things, but there are also potential harms. And remember that aspirin idea, the baby aspirin, it was studied for years, and the guideline that I just reviewed and got updated on, it's a tome of the science. There are 5,000 people randomized per group in these aspirin studies, and they've now they say in the guideline to not use it for primary prevention, but to use it for secondary prevention. Kind of like my spin on the statins. They don't really do much if you don't have the disease already, and don't get treated for something you don't have or you may not ever develop. That just makes no sense. So there are no high-level randomized trials of pycnogenol and Gotu-Kola, even though you look and they're sold, the vitamins and these companies are selling them. And so I'm afraid I wouldn't recommend this one. I just, you want to be sure not only that something works, but that something is safe. And even aspirin can cause bleeding, and that's why it's not recommended over the age of 70 for people, because the risk of bleeding is higher. And so I wonder, if pycnogenol has any side effect. Maybe there's an age limit, and nobody knows. So we're going here on theory and the idea of what it can do rather than the high-level randomized trials or even observational studies of people over time. In this review of the nutrition, I think it was the last one we're going to talk about, there was a randomized trial, but it was studied and funded and conducted by the company that sells the product. That's the nattokinase we're going to talk about. So you want to be leery. You don't want to just base your behavior on one study by a company that's selling it. That's the fox guarding the hen house. You want some independent validation of those kinds of studies. So I'm afraid these two, I just can't recommend.
Number 3 remedy is vitamin K2, which is the most potent inhibitor of vascular calcification. It basically stops the calcification from occurring in your arteries. I would not recommend taking vitamin K2 in micrograms. I would recommend taking it in milligrams. And I've looked around to find a supplement that will give you the amounts in milligrams. There's not many. And I personally don't have a product like that. And I don't have any affiliations or associations with any other companies that do, except I did find one company that does have it, does provide it. It's Life Extension. It's called Mega K2. I'll put that link down below.
Yeah, so I'm searching and, doing PubMed searches and internet searches and research. I understand that you don't get all of the latest information. Going to meetings and talking to researchers is a great way to get the highest level, most recent data, much like we were doing randomized trials of low-carb diets and knew things could work. And even now, people 20 years later don't know about those studies. So I'm well aware that there may be data out there, but we should at least have some information in humans about what vitamin K2 does in terms of plaque reduction or stabilization. And you know, if the story is calcium is healing the process and it goes up over time, and now you're taking something that reduces calcification in the arteries, are you reducing the healing? Are you, so that, you know, we're getting into an area where there's a lot of speculation, a lot of theory, and a lot of these supplements are not supported by randomized trials, even a small one. But even if you have a super small randomized trial and it shows huge effects, there was one where they looked at calcification. No, they looked at arterial stiffness. And when I drilled down to the abstract, there were at least 5 or 6 things they looked at. All the other things didn't change, all the other markers, and they just focused on the one thing that changed in the positive direction. And there were hardly anybody, maybe 50 people or 200 people. Remember, these aspirin trials had thousands of people in them to look at the safety of it. So now, something might work in theory in a test tube in a mouse, but until you have safety data in a human, you're basically taking it at your own risk, which is really what these are so far, and including this last one.
So the next remedy is nattokinase. Nattokinase can help decrease the thickness of the carotid wall. And the last remedy is called niacin. Don't get the sustained release one. Get the one that creates the flush. I know some people don't like that, but as far as cholesterol goes, it is what you need.
Well, niacin is a drug at a certain level that does have data behind it, and it actually has an effect like a low-carb diet. Low-carb, high-fat diets reduce insulin resistance, and niacin, the fibrates, those were all drug treatments that basically reversed insulin resistance. So if you're using a therapy, a strong therapy like diet, remember my secret weapon is changing the food. I don't need medications. The question remains is, aren't you getting these vitamins in the food? They may come from the bacterial degradation in your gut, but that's fine. I mean, so do you really need to take extra? A lot of these nutrients are actually found in the low-carb, high-fat diet foods naturally. So the question is, do you need to take this supplementation if you're changing your food, and your food is your therapy? Remember, if you're one of my patients, I put all of those pro-inflammatory foods into that red box down at the bottom of the poster as a reminder that these are the pro-inflammatory foods, and the foods you want to eat are the proteins, the meat, poultry, seafood, and fish, and eggs. That's where it should start. Protein comes first. So precious little data, no randomized trials on nattokinase that are sufficient and not studied by an independent group. So I really can't recommend these, even though I know it's out there on the internet, and all it may do is lessen the size of your wallet. All right, nobody carries cash anymore. So reduce the bank account size.
Now, I'm not advocating that you take just a lot of nutrition. I'm giving you the ones that are the most potent. I'm also going to talk about some other ones next that also create some amazing effects for plaquing. I just want to mention them because I don't want to leave them out. Tocotrienols helps decrease inflammation of the arteries. It's a type of vitamin E. Berberine is a really good one. You have also aged garlic. You have magnesium and potassium that helps to soften up the arteries if they're stiff and rigid. And then you have vitamin D, which is a very potent anti-inflammatory, really good for the arteries, really good as an anti-plaquing vitamin. And so I put a lot of the references that I talked about down below. Check them out. But if you would like to know the best meal or foods to help you avoid plaquing.
Yeah, so how do you put all this together? Inflammation is the story of the day. So the research for a long time now, researchers have talked about inflammation being the root cause of pretty much of chronic medical problems. And not all the guidelines are up to speed on that, but the blockbuster, most selling and profitable drugs now are the anti-inflammatory drugs. And of course, our perspective is that you reduce the inflammation from the food as much as you can. So stopping the sugars and ultra-processed foods is a great start for that. Do you really need to add in these sorts of compounds which have they have theoretical benefit, or maybe in the test tube or in mice, but there's no human clinical trials showing benefit from these? I'm sorry, I draw the line there and say I can't recommend it as a policy. Now, if you want to take the risk and you think the risk is low, so many other people are doing it, that's your own choice. But I can't recommend, as a evidence-based physician at a major university medical center, I can't recommend something without science behind it that's solid, that's human, that's reproducible. And if I had a positive calcium score that was high or evidence of plaque, I would stick with aspirin as a even if I haven't had a outcome yet, the stroke or heart attack yet. That's called secondary prevention. If you've had that disease manifestation, then there's great evidence that aspirin is worthwhile taking. And it's interesting. It's kind of flip-flopped like this. But when we talk about nutritional supplements or just food itself, nowhere near the clinical trials, which you might expect. And you could argue, well, no one's going to study these supplements because, who's going to make money from it? Well, there are companies making money from it because they don't make claims, they don't have to go through the FDA approval process. That's an interesting thing that I only learned because I was in the FDA sort of approval process for the smoking cessation drugs. And so any supplement can put, something on the label and then say there are these claims or the statements have not been evaluated by the FDA. And so they're not technically claims. So they are able to sell these products based on the theory, and they're massively popular. But that doesn't mean you should take it, and especially if you're having side effects from it. But I see people now coming in, on 5 to 10 supplements, complaining of side effects of something. My first thing is to suspect that maybe it's the supplements causing the side effects. But you take a supplement, there's a side effect. You take another supplement. It's kind of like taking a medicine, and you treat the medicine side effect with another medicine. I'm out of that rat race, that game. So my secret weapon is food. Well, if you find this helpful, please, click on like and subscribe and ring the notification bell to get future videos. I'm sending out new videos every Wednesday and Friday now. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.